My name is Dawn Mechanic-Hamilton. I'm a clinical and research neuropsychologist in the Penn Memory Center and the Alzheimer's Disease Research Center. And I co-lead the clinical core of the Alzheimer's Disease Research Center. We're often doing cognitive testing to get a better sense of where people are at in terms of their thinking abilities. And that can range from memory, language, visual spatial functioning, problem solving, attention, all different areas of thinking. What we do is we want to assess how people are doing in a standardized way so that we can then compare people over time. So when we're seeing someone for the first time, we don't have the prior testing to compare to. So we compare to other people who have taken the same tests in the same ways at a different time. For our longitudinal studies, we try to test people every year so that we can get a sense of how things are going for them as they're aging. And that can be helpful in thinking about their treatment over time and other questions about their care. For our research studies, we really want to be able to learn more about how people change and how they age in terms of their cognition, also in relation to other aspects of health and living. The frequency of cognitive testing depends on the study. There are some studies, like our longitudinal ABC study, where we test typically once a year. For most people, we're not expecting to see much change if they don't have impairments in their thinking over a shorter period of time. Once someone has a diagnosis, we may expect to see some changes over a shorter period of time. So some of the intervention studies that we do, we would typically test people at shorter intervals, like 3 months or 6 months. When someone comes in for a visit where they're going to do cognitive testing, we typically suggest that you do things in the way you normally would. So try to get a good night's sleep, try to have breakfast, do sort of your typical routine. When you come in for the testing, you'll meet the testers. Typically, you'll be introduced by the coordinator who's running the visit, and it's typically paper and pencil testing. So we may ask you to write things down, to remember some things, to copy different figures. We may ask you to do problem-solving tasks. What you can expect is for most of our testing typically takes between 30 minutes and an hour. So sometimes people will ask if they can have a family member stay in the room as they're doing the testing. And we typically don't do that, because what ends up happening is that having someone else in the room watching you tends to change how you perform on tests and on all kinds of things. And so we typically will just have the tester and the individual taking the test in the room together. People often will find that they're a little anxious coming in, and our testers know that, and they are really very well equipped to, have that discussion and talk about how it might be a little bit difficult to kind of get started, and also that you might be distracted by some of those anxious feelings. Sometimes we'll take a break if you need to. So sometimes people will ask if they can be told how they're doing on the tests as they're doing them. And unfortunately, we can't give that feedback at that time. For our ABC study, we typically send out a letter once a year, typically a few months after the visit has happened, that in very broad strokes indicates how people did overall on the testing. It also includes in that letter my name and my phone number so that people can give me a call if you want to talk about your testing in more detail.